Hello, everyone. My name is Dr. Courtney Ray, and I'm the president of the Society for Black Neuropsychology. And I am excited to be able to welcome you to the second day of our Brain Awareness Week. If you are catching this on the replay, I hope that you will look not only on tonight's talk, but also the other talks that are in the playlist, and make sure that you share it with other people as well. If you were here with us on Monday evening, you were treated to Dr. Travis Shively Scott, who talked about brain health and physical health. And tonight, we are so graciously we're being able to see our great presenter, one of the people who has done so much work in this area, not only as a neuropsychologist, but also as a psychotherapist to the community. We have Dr. Kyr Mariouw, and she will be interviewed by our MET professional development leader, Akeisha Harley. And so we're not going to hold you long tonight, guys. We will have our presentation by Dr. Mariouw, and then Dr. Harley will take your questions live. So if you have some questions about tonight's topic, which is brain health and emotions, please, please, please put them in the chat so that we can ask your questions live on the air, and we'll be able to get all of the things that you want to ask Dr. Mariouw out there, and we'll be able to share it on the screen, and you'll be able to get those nuggets of wisdom that Dr. Mariouw has for us this evening. And so without further ado, I'm going to have Dr. Harley come up. And thank you so much, Dr. Harley, for being our interviewer tonight. And I will let you take it away as you and Dr. Mariouw talk. So I will see you after tonight's presentation.
Thanks for the introduction. Hi, everyone. So I'm Dr. Harley, and I had the pleasure of introducing Dr. Mariouw. She is a rehabilitation neuropsychologist, and she earned her doctorate degree in clinical psychology from the Pacific Graduate School of Psychology at Palo Alto University. She also completed her postdoctoral residency in rehabilitation psychology, as well as neuropsychology at the DMC Rehabilitation Institute in Michigan. Currently, she works at the Detroit VA. And in addition to being a member at large at SBN, she's also the president-elect of the Michigan Psychological Association. Her research and clinical interests include, of course, neuropsychological assessments, neurodegenerative diseases, and adjustment to illnesses and chronic pain. Thank you so much for giving us your time today, Dr. Mariouw. I'm going to hand it over to you to start talking about brain and emotional health.
Absolutely. Thank you so much for the wonderful introduction, Dr. Harley. Over the last 2+ years, many of us have had to really come to terms with, both challenging and uncertain times, through the hardships of the latest in a long history of social injustices, as well as an ongoing global pandemic. There's also this more recent threat of another war. So it's really important for us to remain really mindful of our mental health. Emotionally based stressors like depression, for example, can cause cognitive inefficiencies. So feeling like our brains just aren't thinking as effectively or as clearly as we'd like them to. Sometimes this is feeling just like you're thinking more slowly, having more trouble remembering things, finding it more difficult to concentrate. And sometimes some of these things can become so difficult that people become fearful that, something seriously might be wrong with them from a medical standpoint. So it's really important to recognize that anxiety and depressive symptoms can cause feelings like this and recognize these feelings in ourselves. So while utilizing mental health services may be lower in Black communities, African Americans are really just as likely to experience depression as other groups. Of course, this is adjusting for things like age, gender, education, and socioeconomic status. But sometimes symptoms and the presentation of symptoms can look a little bit different. Far too often, this can lead to Black people sometimes being misdiagnosed or overdiagnosed with other types of disorders like schizophrenia, for example, relative to other affective disorders like depression or anxiety. And some literature has attributed this to, a cluster of symptoms that isn't as readily identified. You might notice things like somatic or vegetative symptoms like weight loss, sleep disturbance, feeling like you're really tired all of the time, changes in appetite, or maybe even irritability, rather than just spontaneously reporting that you're feeling severely depressed in your mood. But this isn't to say that this doesn't also happen. But it's really important just to start to recognize some of these symptoms even before they reach the severity of clinical depression. Being patient and empathic with ourselves and recognizing that we're all just doing our best, even when faced with a shift or sometimes a significant change in the ways that we have previously taken care of ourselves or coped with stress in the past. Many of us have a general routine that we feel really, really comfortable with. And when things go kind of slightly awry or we aren't really able to stick to our routines, then we feel a sense of, when we stick to our routines, we feel a sense of control. And on the other hand, with significant changes and circumstances, when things go awry, as I mentioned, we have to deviate from our routines. And this can sometimes lead us to feeling really anxious or stressed. Many of us are feeling perhaps that way now. We're feeling particularly uncertain. And we have been feeling this way probably for a pretty long time at this point. Things like, when are things finally going to feel like they're back to quote unquote normal? Whether this is due to concerns about our health, the health of our loved ones, potential financial stressors, or the compounded stress of, social inequities and injustices. And I just want to validate that there is a really wide range of perfectly normal responses to dealing with stress. Even though one person's response to stress is likely very different from another person's response to stress. But it's important to remember that everyone reacts differently to stress and feelings of uncertainty. Those with a higher intolerance for uncertainty or stress may feel like they're less resilient and more prone to things like low mood, feeling down, and anxiety. But what I'd like to really focus on is a path forward and what that might actually look like. So what I'm really talking about is coping with stress and uncertainty and regaining a sense of control. One of the first things that I think of when I think about kind of regaining that sense of control is being kind to ourselves. As I mentioned before, some people have a higher tolerance for stress and uncertainty than other people. So just trying not to criticize yourself if your tolerance is lower than someone else's. Just remembering that it may take time for a stressful situation to resolve. So just trying to be patient with yourself in the meantime. Another is reflecting on both current and past successes. So it's very likely that you've probably overcome stressful events in the past and you were able to persevere and make it out on the other side, even though I'm sure that you've been in situations when you felt at the time that it was really impossible. So just try to give yourself some credit and try to remember that, what are some of those things that you did during those times before that were really helpful? And what you might want to do maybe the same this time, or maybe something that you want to do differently. Another might be to develop new skills. So when life is feeling at least relatively calm, make a point to try to do things that are outside of your comfort zone. So from advocating for yourself to trying maybe a new hobby, taking risks can actually help you to develop confidence and skills that might actually come in handy when life throws us a curveball. Another might be trying not to dwell on things that are outside of our control. During times of stress or uncertainty, people sometimes immediately imagine the worst case scenarios. And trying not to get in the habit of ruminating on negative events is actually going to be really helpful to us. Another that I think of is, taking our own advice, because sometimes it's really hard for us to see clearly and objectively when we're in the situation ourselves. So a good practice is just to ask yourself, if a friend came to me with this type of worry or this stressor, what would I tell them? Imagining yourself or imagining your situation from an outside perspective can sometimes help us to generate fresh ideas, or, as I mentioned, just give us perspective. And it might also serve as a gentle reminder just to be kinder to ourselves. It's also really important to remember to take care of yourself. Self-care is important, and it can help us to avoid burnout. As I mentioned, we've been kind of in a pandemic for over 2 years at this point, and it might feel like burnout is inevitable. But try not to let stress derail healthy routines. Making an effort to eat well, exercise, get enough sleep, meditate or pray, and spend time engaging in other types of activities that you find personally meaningful. It's also important to seek support when we need it from people that we trust. Sometimes people might isolate themselves when they're feeling stressed or worried, but social support is really important. So try to remember to reach out to loved ones, whomever they might be, family or friends, and try to control what you can, especially when things feel like a lot of things are out of your control. So focusing on things that are. It can be something as simple as weekly meal planning or laying out your clothes the night before a stressful day. Establishing a routine to give your days or your weeks some structure can be really comforting. And the other is asking for help. If you're having trouble managing stress and coping with uncertainty, again, remembering that different people have different tolerance levels for things like stress and uncertainty, we can ask for help. And the Society for Black Neuropsychology, of course, has a directory of wonderful neuropsychologists, should the need arise. And the Association of Black Psychologists is another resource to consider, in addition to things like local state psychological associations and websites like Psychology Today that people are familiar with. But just making sure to verify the license, the skills, and the experience of any providers that you might seek out to make sure that it's a really good fit for you. All right. And I would like at this point to open up to questions. I think it might be just slightly over my time.
No worries. Great presentation. You made a lot of great points. One of the questions I had is I loved how you talked about maybe some of the more physical symptoms of mood issues. What are some of the more like how can our mood impact our thinking skills? What might some people experience with anxiety or depression or other mood issues?
Yeah, absolutely. And sometimes I think of this as kind of everyone has a basket, right, when they're out in the world. And if you are dealing with significant stressors, you're have a lot going on internally, I think of that sometimes as kind of internal noise, right? And if you have this internal noise going on all of the time, it's really hard to take information in, right? So you might feel like, oh man, somebody just told me this and I already forgot. And then you might get more down on yourself because you aren't remembering something that you know that you should, right? But recognizing that some of this internal noise might be related to things like anxiety or the stresses of our day-to-day lives.
That's awesome. I love that analogy. I like the basket. We have a question coming from the audience. So, How do you know when it's time to seek professional help with emotions, and how do you find someone good?
That's a great question. Um, so it's really important to um, remember and remind to notice when you're not feeling exactly the way that you should, right? So if you ever find yourself feeling like you just haven't been motivated, or you feel like it's become such a struggle to do the things that you have to do, that the things that you do just for yourself really fall to the wayside, it might be a good time to consider, I say, evidence-based therapy, because the markers like the ones that I mentioned are often indicators that, you might have this mental noise that we just talked about. So either persistent worries or negative thoughts that make it difficult for your brain to do its job and think as clearly and as effectively as it should be able to. So of course, that might be an indicator that it's time to find a therapist to kind of get a handle on the noise to maximize your brain functioning. And in terms of finding someone to kind of pursue therapy with, as we mentioned, I think that either your state psychological associations might be one place to start. I know that psychology today is something that is very popular, but I do like to just offer just a word of caution just about making sure that the person that you seek out is fully licensed and it specializes in the type of difficulty that you may be working through.
Awesome. Kind of a follow-up to that question. You mentioned that therapy can help reduce some of that noise you were talking about. What are some ways that interventions in therapy can help someone's brain health?
Yeah. And so getting a handle on kind of that noise can look a little bit differently depending on kind of what that noise looks like for you. Sometimes it could be as simple as kind of recognizing at least we are having an emotion, we're feeling perhaps badly about ourselves, right? So it might be important to remember, what was the last thought I had before I started feeling this way? And it might be important to then notice, was that thoughtful, a helpful thought, or was it maybe not so helpful? And if it wasn't so helpful, then maybe challenging whether or not it's 100% true. Because a lot of times, especially when we are feeling really stressed, the first thought that comes to our mind can be a negative one, right? And the thoughts can come so quickly and maybe be so familiar because we have them all the time that we don't take the time to stop to think whether or not it is actually true, right? And oftentimes we can usually think of some evidence that might support maybe some truth in the thought, but oftentimes there's probably some evidence that it's at least not 100% true 100% of the time. And leaving that little wiggle room can kind of sometimes give us the kind of distance to look at it a little bit more objectively.
Awesome. So we have another question from our audience here. Is medication always the answer?
Well, as a neuropsychologist and a clinical psychologist, first and foremost, I would say that unless you're dealing with serious mental illness, so something like psychosis, bipolar disorder, I would say that oftentimes medication isn't even necessarily the first line of treatment, unless it's something very severe or treatment resistant. Because sometimes medications, particularly things like SSRIs or medications that people take for mood, can sometimes not address the underlying problem, or I don't want to say problem, the underlying issue, right? Which might be that there are some valid and significant stressors in your life, right? And we might not be handling them as effectively as maybe we could. So having the tools and some skills surrounding that would actually help in the long term, probably much better, or at least as effectively, sometimes more so than medication.
Here's another question, kind of on the lines regarding treatment. What about people who are caregivers? How can we best support loved ones who are struggling without making things worse?
Absolutely. And I hear this a lot from some of my patients too, is that people oftentimes really want to relate, especially if it is someone that you love. And oftentimes people might hear things like, oh, I know what you mean. I know what you're going through, right? And the truth is that we never really know what anyone else is going through. We only have our personal experiences. So sometimes validating some of the concerns or some of the feelings, right, is the best thing that we can do, right? So not challenging necessarily, maybe we don't even have to agree, right? But validating that their experience is true for them and that we still love them in spite of everything.
What about some resources for parents and for children? What are some resources for parents to help them understand when their children need help dealing with emotions?
Yeah, I think that children and adolescents as well, they aren't always able to very clearly articulate the ways that they're feeling in ways that at least that we are used to hearing. But they are often very emotionally aware despite of this. And it's really important to validate, again, these emotions of little ones, the good
Mhm.
and the quote unquote bad and the ugly as well. Because no emotion is inherently bad because they teach us valuable information, right? About things that we'd like to move toward and things that we'd like to move against. So helping children and adolescents to put words to the way that they're feeling and tolerate emotions as pieces of information facilitates, emotional intelligence, and it can actually serve to maintain brain health.
Awesome. So one of the things you mentioned, Dr. Mario, in your presentation was kind of all the stressors we've been dealing for the past over 2 years now. Um, because of these things, sometimes it's just hard to disconnect, given social media, the news. Um, what are some ways that we can disconnect and take care of our emotional well-being that's good for our brain health?
Mhm. And I honestly think that it's really important to sometimes limit our exposure to the news. I know that it's really important to remain aware of kind of what's going on in the world. But when we're stressed out and thinking about something a lot, it can actually be hard to look away, even in times that sometimes we need to take care of ourselves. Um, Compulsively checking the news, for example, can only serve to keep us wound up. So, as I mentioned, it's really important to remain informed, but maybe doing that in very conscious ways of, checking in the morning, maybe in the evening or right after work or during the midday, just because we, of course, don't want to devote a lot of our mental energy to things that are stressing us out. It might be important to also limit these check-ins by avoiding the news during times that we're feeling particularly vulnerable. So these are things like before bed, because we don't want to go to bed ruminating about things that are stressful to us. And, especially after a particularly stressful event or situation, that might not be the best time to look at the news, because that's just going to compound your stress and give you kind of an overall negative worldview because you're only seeing the negative. Sometimes we have to give ourselves breaks to see the positives in life, just to give us balance and to also keep our thinking as realistic as possible.
Great. We have some more questions from our audience. Someone asked, can prayer and meditation help us deal with stress?
Yes, absolutely. And oftentimes people find a lot of solace in prayer and meditation. And I do actually encourage people to stick around for our next presentation, because it's actually going to be looking at brain health and spirituality. And it's going to be presented by Dr. Ray, who actually also has a master's degree in divinity as well. So I will defer to her about the specifics of this, just because she knows far more than I do. But the answer is absolutely yes.
And kind of on those lines, you mentioned in your presentation that we shouldn't wait till our baskets are too full before kind of seeking help. So what are some, and I'm a big advocate of preventative care, what are some ways to implement preventative care at home to help our emotional functioning and develop our cognitive health?
Mm-hmm. Absolutely. So I think that the very first thing is just at least recognizing when your basket is getting full, when there is a lot of kind of internal noise that is causing us to be a bit more distracted from kind of remaining in the present moment, right? And so it's really important to, as I mentioned, remain mindful of our thinking patterns and how they are impacting our mood, and to challenge the thoughts that are not necessarily super helpful for us. But in addition to that, I think it's also important to remember to continue to engage in activities that bring us joy, right? Either bring us joy or bring us some sense of accomplishment, right? Because as you mentioned, when things start to feel, it starts to feel so difficult just to go about our day to day and do the things that we have to do for survival. Sometimes the things that we do for enjoyment, just as I mentioned, fall by the wayside. So we want to make sure that we are remembering to do things like, I have an example here, so I'm going to talk around it. The example that I have is something that is going to be cognitively stimulating, something that is going to bring you a sense of either peace or joy, and something usually that involves some sort of social interaction. These are the things that are really the best for not only our emotional health, but also our brain health. So remaining really mindful of that is really important. And I know that getting all of those things in one sounds like it would be really challenging. But if you think about something even as simple as like bowling, right? It's something that people usually do with other people. It's something that involves math to some degree. So you get that cognitive stimulation as well, get to move around a bit, get to leave your house. And I know that, during the pandemic, some of these things have been a little bit more challenging, and we've had to be really creative, honestly, but just remaining mindful of kind of the ingredients that we need to kind of maintain both brain and emotional health.
Awesome. So on Monday, someone had asked during our talk, right, that are there any neuropsych interventions that target emotional health outside of SSRIs?
Mm-hmm. Yeah, so kind of honestly, the things that I mentioned before, activity is really, really important, right? So just remember the ingredients are cognitive stimulation. So you want to get your brain thinking. You want to make sure that you are socializing with other people. Because oftentimes, if we aren't feeling great, we have these thoughts that, we don't want to be bothered, right? But it is really important to not only reach out to our friends or loved ones, but it's important to make an effort to see them as well. And then the last is kind of things offering some sort of exercise. And I don't mean that you have to go for like a 5K or anything like that, but just make sure that you are getting your body moving. And these are also great for things like chronic pain, in addition to kind of brain health and emotional health.
Awesome. Any other lingering questions from our audience? Well, Dr. Mariouw, I don't want to keep you too long. I want to say thank you so much for joining us today and giving us the wisdom on neuropsych, emotions, and our brain health. I will pass it off back to Dr. Ray.
Thank you.
Thank you guys so much for just this enlightening discussion. This was really great. I know that a lot of people had been asking, as Dr. Harley talked about, we had people from on Monday who were asking about some of these things already. So this was actually one of the topics that people most wanted to know about, especially in the Black community. We don't necessarily talk a lot about emotional health to the extent that we talk about how professionals can help us. So thank you so much for sharing these insights and everything. And I really am glad that you talked about being kind to yourself and being easy on yourself sometimes. We can ruminate with the things that we did wrong. We don't say things the right way. We don't do things the right way. And those things kind of ruminate on our minds for a really long time. And so I'm glad that you mentioned just being kind to yourself. I think that is a big deal. We all make mistakes, right? I made mistakes throughout this this broadcast, and we have, yeah. And so we all need to just be a little bit kinder to ourselves. Yeah. Thank you so much for giving your time today to answer the questions from the audience and to give us this presentation. We really appreciate it.
Absolutely. Thank you for having me, and thank you to everyone that turned in.
All right. So this was the second of our 4 presentations for Brain Awareness Week this week. We have 2 more on Friday night. We will be talking about brain health and spirituality, and that will be conducted by me. And we will also have a special presentation by our research director from SBN, Dr. Valencia Montgomery, and she will be talking about research and why it's important for the Black community and how you can actually be involved. Yes, you, a member of the community, you don't have to be a person who is a scientist, but you can be involved in research and important work that helps our community learn more about brain health. And so we want you to stay tuned for those on Friday, the same time. This is 7:30 Eastern, 4:30 Pacific. And on Saturday, same time in the evening then. And if you're catching this on the replay, once again, we're encouraging you to look at all of the different videos that were on the playlist and to share it with someone else who may be struggling with ways in which they need to improve their brain health and they want to get to know a little bit more about practical things that they can do to try to strengthen their cognitive reserve and help their brain functioning. And at any age, brain health is important, from children all the way up to our older adults. So we want to make sure that as many people as possible understand how important it is to really hone in on these subjects while they can. The best time to start is today in taking care of your brain health. We hope to see you for our next presentations, Friday and Saturday, if you are watching this live. And again, if you're replaying this, go ahead and click those other videos and watch then. Take care and have a good evening.